Dealing with difficult patients is something every healthcare provider faces at some point, especially in private practice where you're often balancing clinical care with business operations. We have all had to deal with patients who are the aggressive patient, the know it all, the chronic complainer, the silent, unresponsive patient, the non compliant patient. So, how do you manage these challenges without burning out or compromising care? First, let's recognize the types of patients who might be challenging. They're not always intentionally difficult. Sometimes it's anxiety, pain, or miscommunication that causes friction. Each type requires a different approach, and it starts with staying calm and curious, not reactive. The number one rule: set boundaries early, preferably at the very first appointment. Have clear office policies on cancellations, communication, and expectations. When patients know the framework, they're less likely to push against it. Sometimes people just want to feel heard. Repeat back what they say, validate feelings even if you don't agree with the behavior. Empathy doesn't mean enabling, but it builds trust. Documentation is your best friend, especially if a patient becomes disruptive or non compliant. Keep a record of every interaction that strays from the norm, including missed appointments, complaints, and care plans discussed. Sometimes the best way to help is to know when to step away. If a patient crosses ethical boundaries, is verbally abusive, or consistently refuses care, it may be time to refer them to another provider or formally dismiss them. Just make sure you follow legal and ethical guidelines when doing so. Lastly, difficult patients can take a toll. Don't forget to care for yourself. Peer support, supervision, or just debriefing with a colleague can make all the difference. Private practice is rewarding, but it comes with its challenges. By staying professional, setting firm boundaries, and keeping communication clear, you can handle even the most difficult situations with confidence. If you found this helpful, like and subscribe for more tips on private practice management. Drop a comment below if you've ever had to handle a difficult patient and how you managed it.